April is Women's Health Awareness Month. Sometimes there are symptoms you may be experiencing, but just don't realize that they could lead to some health concerns. Today, we are joined by OGBYN nurse practitioner Kandiss Inman. Kandiss, thanks for being here today.
Thanks for having me.
Appreciate it. So what are some of the things that women sometimes may overlook in their health?
Well, this is an interesting time because I feel like women are pretty behind with screening in general with COVID and making sure that their kids are getting in for their things. You know, colon cancer screening starting at about 45, getting in for their pap smears and mammograms, mental health. Those are really some of the big ones. Dental exams, that there's a correlation with good hygiene and getting teeth cleanings and improved cardiovascular health in general. You know, just those really.
Those are the main things.
Yeah.
And so what signs or symptoms would be important to be aware of?
Yeah, any type of, you know, chest pain or, you know, sleep disturbances, things like that, those things can lead to chronic conditions. There's obviously, you know, signs and symptoms of chest pain or stroke. Those are big ones. Other things, really just listening to your body and, you know, staying in touch with your healthcare provider if there are things that are changing with your body.
And more with that too, how can women be proactive? Are there small things they can do to keep on top of their health?
Yeah, I would say definitely keep moving. Exercise is big, just little things that you enjoy doing, whether it's with your kids, your family, and staying really aware of your mental health is a big one. Sleep hygiene is huge. Sleep is, you know, we have crazy schedules, but trying to stay with a good sleep schedule is really important.
I would say sleep hygiene makes it sound like you've got to clean something, but you just mean having a good routine? I
mean having a good routine, trying to go to bed at the same time every night, even on the weekends, and just trying to get good quality sleep. It's really important for overall health.
And how about for, you know, heart health? And, you know, we hear a lot about, you know, wear red for women. You know, I can't remember which month that is. But you know, being aware of the signs, getting your EKGs, I guess, and regular screenings too. Yeah.
Well, I think the big thing is trying to just get in at least once a year for your routine wellness exam. Blood pressure screenings are really important, and that's something that's done even at the dentist. But just that's kind of gives us initial things that you may lead to cardiovascular disease, which is actually the highest rate of mortality in women. Everybody thinks about breast cancer and cervical cancer. Those things are really important, but also just these basic things too.
And real briefly too, Mother's Day is coming up. What do you want people to know about that time?
That's actually Mother's Day is actually the kickoff to Women's Health Awareness Week, and it's really just to try to get people to remember to stop and put your own health first.
All right, Kandiss, thank you so much.
Great
information too, just encouraging the women to get checked out. Thank you. And we'll be right back.